Eric, now to our complete coverage of coronavirus in the borderland.
Today, ABC7 found out the city of El Paso does not have the capability of testing for the Delta variant, which is the dominant strain in the U.S.
However, the city told us in a statement, quote, "We do not have the capacity to test locally at our lab, but our laboratory response network partners, where our testing is conducted, has a large network of laboratories with variant testing capability for our city."
After that city sent out that comment, ABC7 wondered if those other laboratories were actually testing all positive cases in El Paso to detect the Delta variant. So we asked, and the city responded, quote, "The CDC has a program with national laboratory chains to randomly test based on qualifying indicators. This is the case for all variants. Also, if any hospital asks us to conduct variant testing, we will do so at the request upon demand. Again, we've been testing for all the variants."
For weeks, city officials have said the Delta variant has not been detected in El Paso. ABC7 spoke with El Paso Health Authority, Dr. Hector Ortiz, who says it's just a matter of time before it's found here in the borderland. But he stressed local samples are being tested for it.
Not because in our Department of Public Health laboratory cannot do the genetic sequencing doesn't mean that we're not sending samples. We continue to send samples via the state. We continue to have samples being surveilled by the CDC. The testing has been done, even though it's not done locally, but samples have been sent from our community.
Now, this story about the Delta variant made me curious about the spread of COVID-19 in El Paso right now. So I looked at the city's data and I noticed there is an increase in infections and some substantial ones at that. Let's start with the positivity rate that you see right here, which is, of course, the percentage of people who test positive in a week. Now, back on June 14th, just over a month ago, it was 1.18%. But the latest data from yesterday shows the positivity rate is at 6.55%. That's more than 5 times greater in just 1 month's time span. Now, let's take a look at COVID hospitalizations. Back on June 14th, there were 39 patients in the hospital with COVID-19. But yesterday, the city of El Paso reporting that number had increased to 72. Now to the number of cases reported in El Paso. Back on June 14th, the city announced just 6 people tested positive. And yesterday, officials reported 64 new positive cases. That's the second day this month with more than 60 new cases. We haven't seen numbers as high as this since May. However, Dr. Ortiz doesn't think things are going to get as bad as last year.
I don't believe that we're going to be seeing a large surge the way that we saw it in October, November. At that time, there was a lot of people that were susceptible. We did not have the vaccine, and unfortunately, we were the hottest spot in the country. I don't believe we're going to be in that point.
Because, of course, that whole pool of El Pasoans at that time were unvaccinated. Now, city data shows that more than 77% of eligible people are fully vaccinated. Just today, the World Health Organization warns surge in cases in many parts of the world increases the likelihood that new potentially dangerous variants may emerge in the future. Dr. Ortiz says the best tool to fight variants is, of course, getting vaccinated.